Thank you, everybody that has joined us for today's Western Regional Agricultural Stress Assistance Program Network Quarterly Meeting. My name is Esmeralda Mandujano, and I am with the California AgrAbility Program at the University of California, Davis. Our program is responsible for hosting this network quarterly meetings for the WRASAP network, and today's presenters are from our partners at Colorado State University and Utah State. I will speak a little bit more about our presenters shortly. So I wanted to start off with speaking a little bit about the Western Regional Agricultural Stress Assistance. It is funded by the USDA NIFA and the Farm and Ranch Stress Assistance Network Grant, which establishes regional networks that connect agricultural producers with resources to assist them in times of stress. And when we speak of agricultural producers, we mean farmers, ranchers, farm workers, and others in agricultural related occupations. So it is a very diverse group of farmers and farm workers that we have in the region. This grant establishes 4 U.S. regional programs, and these regional programs, you can find out more information about each of these FARSAN regions on our webpage, farmstress.us, under About. Specifically for the Western Regional Agricultural Stress Assistance Program, we are covering an area of 13 states and also 4 territories. And WRASAP efforts include several partners. Some of the leading organizations are Washington State University and Montana State University, as long as and the University of California. The efforts that this program include are a clearinghouse, adding a clearinghouse. And if this clearinghouse seeks to build a comprehensive searchable database to facilitate easier navigation of resources. The clearinghouse is currently active on farmstress.us, and it is being built out more as time progresses. WRASAP also has a small grants program, which provides funding to partners in 3 different areas, in the area of outreach, in the area of translation, and also in the area of professional development. Another effort is adding call staff, and the call staff are also helping to extend existing hotline operation hours and training for line staff to better support agricultural populations. And then the part that we are here for today is the networking part. The network that we're trying to establish is a collaboration and expansion of network to ensure culturally humble community outreach and support in the Western region of this 13 states and 4 territories. So for the part that we're here for today, the networking meetings, this is intended to be a space where stakeholders are able to build connections and collaboration to assist agricultural producers in times of stress. It is also a space to improve behavioral health awareness, literacy, and outcomes for agricultural producers, for their families and their communities. And it is a space for collaborators to present their efforts and offer opportunities to pose questions to bring experiences to the table. This meeting is open to the public, and we encourage external partners to join these meetings so that we can learn from each other and know what efforts are being done in the West to support farmers and farm workers in the area of farm stress and mental and behavioral health. So next, I'm going to ask Dr. Michelle Grokey to give us a little bit of information on the work that she's doing, give us an announcement of the current baseline survey that her team has active.
Great, thanks Esmeralda. Hi everyone, and thank you for joining us. So as Esmeralda was saying, there are multiple parts to this WRASAP project, and one of them is collecting data from individuals that are part of their agricultural communities throughout the Western region of the US. And so right now we are currently in the middle of distributing an online survey to agricultural producers. The survey is being distributed through the Qualtrics platform. And really the intent behind this is to figure out those stressors that farmers and ranchers are currently facing. So the interview, or the survey, excuse me, takes about 15 minutes to complete. And so we are currently distributing that across the 13 states. And with the information and the data that we get from these surveys, it will be used to inform a lot of our WRASAP programming and outreach efforts that are coming through the grant project. So at the moment, Esmeralda is gonna share within the chat box the link to these surveys. So we have surveys currently in English and in Spanish. Please check out the link, and if you could be so kind and forward this link to those in your networks across your states. Our goal is to keep this open until the end of May. And then after that, we will start creating statewide data outcomes, presentations, and then one that aggregates the entire Western region. If you have any questions about the questions on this survey, the goal with what we're going to do with the data, please let me know. There's also an info sheet coming through in the chat box with my email. You can contact me directly, and we look forward to hearing from you, and thank you in advance for helping us distribute the survey to ag producers. Thanks, Esme.
Thank you, Michelle. So I will now introduce all of our speakers to follow with their presentations, and we will collect questions from the chat and post these at the end. Our first speaker is Dr. Bob Fetsch. He has been a longtime AgrAbility staff member and a principal investigator or leader of the Colorado AgrAbility program. He has also worked with the University Extension at Colorado, and his expertise lies in family life issues, especially related to resilience and stress. And he also works with families on topics of stress, depression, and suicidal ideation. He is the leader of the AgrAbility Quality of Life Study. And although he has been retired for a decade, he is still actively working to bring resources to support farm families in the area of mental health. Our next presenter from Utah State University is Dr. Aller. He is a senior program coordinator at the Center for Persons with Disabilities at Utah State University, a University Center for Excellence in Developmental Disabilities. Dr. Aller is interested in mental health prevention programs in varying populations, including rural residents, and he is also interested in studying the implementation of acceptance and commitment therapy and prevention and short-term interventions. With him, we'll also present Tasha Howard. Tasha is an assistant professor for Utah State University Extension. She is the Extension County Director for Joab County. Her roles include working in the home and the community department with a focus on health and wellness programming, positive family relationships, and 4-H and youth development. And her passion lays in working in rural mental health programming with an emphasis on helping farmers and ranchers. And with that, I'm going to turn it over to Dr. Fetsch.
Thank you, Esmeralda. Appreciate you inviting me today to talk about an overview of mental behavioral health in farming populations. It's a pleasure to be here with you. Well, where I want to start is pain is not always obvious. I had a physician one time tell me, you know, Bob, he said, whenever I'm working with a farmer or a rancher and I ask them that 0 to 10 scale, how bad is your pain from 0 to 10? I've learned over the years that when they tell me it's a 5, I know it's a 10. And that's been true with my dad and my brother, being the 4th and 5th generations of farming in our family, that they didn't show their pain. They don't show their pain unless it's almost killing them. So we need to remember that as AgrAbility projects, as we work with farmers and ranchers with disabilities. Well, as Esme said, many farmers and ranchers and farm workers are reporting that they're worried, anxious, or fearful of what the future holds for them. And there are lots of reasons for all this. Those I mentioned here, plus others that include multi-generational farm lineage and succession, chronic illness, cancer, harsh weather conditions, COVID-19, a lot of things are going on that lead to these kinds of emotional reactions. Some of our Colorado State University Extension agents and agricultural producers are starting to see signs of high stress, anger, depression, and even suicidal thinking, not only among their neighbors and friends, but sometimes among their family members. So I want to talk about that and want to focus on that today. What can we learn from research studies? First of all, male principal operators with high levels of depressive symptoms had a threefold risk of farm work-related injuries. And those of us who are involved with AgrAbility projects, I think ought to pay close attention to this. And this was written by my colleague, Lorraine Stallons in Vessler. Depression was associated with high-risk behaviors such as failure to remain calm around livestock, not reading the instruction manuals or safety precautions, and not using shields on moving equipment parts. And that makes them more vulnerable to high accidents on farms and ranches. Another thing we can learn from research studies is that the farm and non-farm male suicide rate was nearly 4 times higher at 22.4 per 100,000 than among females, 6.1 per 100,000. And the suicide rate for males working in agriculture, forestry, fishing, and hunting was 2.5 times as high as the national average for male and female suicides in the US, which was 14.2 in 2018. Here's another source of where I get this information about how high suicide rates are among farmers and ranchers. Peterson and his colleagues did this research for all industries or occupations. And the average up here was about 26 per 100,000. But for farming, fishing, and forestry, it was higher. What you can see here, it's right at 31 per 100,000. And agriculture, forestry, fishing, and hunting was right at 36 per 100,000. So it was close to 3 to 4 times as high as the national average for suicide. And I say that because I want us all to be aware of this possibility among the people we see and know what to do when we do see the signs. Well, I want to share with you some suicide red flags. Who's most at risk of suicide? I like this slide from the National Institute for Mental Health.
Dr. Fetch?
Yes.
We're having a problem with your slides. They're not coming up.
Oh, okay. You have a copy. Can you access them then?
Yes, just let me know which slide number are you on?
The 2018 WISCARS U.S. suicide rates. Let's see. It is number 9.
Number 9, okay. Right there.
Not yet, Luke.
Can you see the slide?
No, I can't. Not yet. Let's see. Let me go here. See me. We're here. There you go. Oh, where'd they go?
This is hilarious.
Lou?
I think we're good. We can see the slide.
Okay. All right. Well, what this slide shows is that when you look, I guess we're okay, is that the suicide rates for Black females are down here pretty low at about 5 per 100,000 at their peak, then white females at about 12, Black males at about 22, but white males are most at risk. You see the suicide rates for them, especially among 75 to 79-year-olds, are 40 per 100,000 on up to 52 per 100,000. Those are the ones we particularly need to pay attention to, especially those white males who lose their spouse and their meaning. That is, if I'm not a farmer or rancher anymore, who am I? Next slide, please. Are you seeing? Oh, there it is. Okay. I want to say a little bit more on that. These are suicide statistics, not suicide attempts. 3 out of 4 suicides in America are committed by men, and women in the US are roughly 1 to 3 times more likely than men to attempt suicide. All suicide attempts, whether by men or women, we must pay attention to, because that's a high risk indication of what they may do in the future. So Esme and I are hearing reports lately, though, that since the pandemic, Black men particularly are among high suicide rates. So it's important that we pay attention to these kinds of things in our own communities, because in our own communities, it may be a little different. Well, there's increased family stressors. Depending on where you look, between 96 and 98% of US farms were family farms, owned and operated by families. And so when we deal with farm and ranch families, we need to pay attention to, when they get a disability, illness, or condition, how it affects all the stakeholders in the family. It affects grandpa and grandma, it affects dad and mom, it affects the kids and all. So we need to pay attention to that. Next slide, please. The common cold of modern psychology is depression. And what is the most effective cure for depression? It's a combination of counseling and medication. In one study, 80 to 90% of people who sought counseling for depression and had antidepressant medication got better in a relatively short time. And so that's when we have farmers and ranchers who are depressed, we need to refer them to a psychiatrist or a physician for counseling and medication. It works. Next slide. We've seen progress in reduced numbers of physical fatalities and injuries thanks to OSHA and Extension farm safety programs, but we've not seen progress in reducing behavioral health issues like suicide, especially among older white men. Next slide, please. Factors that may contribute to this risk of suicide are many, but some of those are depression due to chronic pesticide exposure, increased access to lethal means. As you may know, firearms and hanging are the 2 leading methods of suicide for male farmers. Access to mental health services can be limited in rural locations, and finding time to leave the farm to receive medical care or behavioral health care can be challenging. Next slide. It's not increased levels of mental health illness. It may have to do with demands of family farms and the culture, or the shortage of professional health care providers, high accessibility to firearms, occupational stress, financial difficulties, and family problems. And of course, farmers and ranchers don't usually retire. They just slow down, I guess you'd say. Next slide, please. Why is it high then? We think here at Colorado State that it has to do with the scripting we do with our little boys, where we train boys differently than we do girls. We tell them, no sissy stuff. Men are expected to distance themselves from anything feminine. Be a big wheel. Men should be occupationally or financially successful. Be a sturdy oak. Be confident and self-reliant. Give them hell. Men should do what is necessary to make it. And I added a 5th one, when you're hurting, be a man. Keep it inside and tell no one. Next slide. We don't say these things to our girls. So when you and I notice a family member or friend who is stressed out, angry, depressed, or suicidal, where do we look for help? These next 4 websites are the 4 I like to look for, because they are national websites where I can find local behavioral health therapists available. Next slide, please. If you're unsure, refer. Next slide. Esme made available my checklist. It's with the registration list. You can look there for signs of high stress, high depression, high suicide risk, and how you make an effective referral. So I refer you to do that. You've got a copy, make as many copies as you want and hand them out to people who want them. Next slide, please. I wanted to show you this slide for a number of reasons, but one is it's the latest national map that's available with 2019 data. What you see here is the top 3 states. When you take a set of data and you cut it in fifths, they call them quintiles. And the top quintile data has to do with Montana, Wyoming, and Alaska. And in that quintile is our SRAP, or State or Regional AgrAbility Project Alaska, with 28.5 per 100,000 suicide rates. They're in the top quintile in the country right now. In the next quintile, unfortunately, is us here in Colorado, New Mexico, and Utah. 3rd quintile is Washington with 15.9 per 100,000. And the fourth quintile is SRAP California, 10.7 per 100,000. One of the things I'll share with you, I noticed this when I moved to Colorado in 1985, that the mountain states are always in the top quintile, and they have been forever since we started collecting data. So out here in the Western United States, in the mountain states especially, we see elevated suicide rates. Next slide, please. What can you and I do? We can watch for subtle signs that something is not right, and don't wait for the quote right time. Next slide. We recognize signs of high stress, anger, depression, and suicidal thinking. Use that checklist that Esme provided you. Take action. Find out where your local resources are. Check your yellow pages. Check the 1-800-FARM-AID line. Call them. Call 1-800-SUICIDE. Next slide. Again, you've seen this one before, so we'll skip it. Seeing a therapist doesn't mean there's something wrong with you. It means you may be seeking clarity or have complicated emotions or traumatic experiences, and you're trying to cope. Let's stop shaming people for looking for behavioral health. Next slide. What are some last line signs of suicidal intent? I'm thinking about calling it quits. Maybe my family would be better off without me. Let's have a last cigarette together. Want to buy a box of shells with your new handgun? Only need one. That was told to me by in one of my workshops by a workshop presenter. And the young man who sold the gun didn't catch it. And so he said, I can't sell you one shell. You got to buy a whole box full. So the farmer bought a box full, went home, took one shell and used it to end his life. Another line, I want to show you where the keys to the truck are in case anything happens to me. Next slide, please. If and when you see or hear something like that and the hair on the back of your neck goes up, you might use what Comet recommends here. You don't seem yourself lately. How are you doing, Joe? No, really, how are you doing? I've noticed you haven't been at coffee or football games. I've noticed you seem kind of stressed, down, and distracted. How are things at home, work, or school with your friends? Can we get coffee sometime soon and talk? Can I call you sometime? We need to build a bridge in order to refer people to professional behavioral health therapists in our neighborhood. Well, what's the vision of AgrAbility? The vision of AgrAbility is to enhance the quality of life for farmers, ranchers, and other agricultural workers with disabilities, so they, their families, and their communities continue to succeed in rural America. Next slide. Well, what works to reduce depression and increase hope? I'm happy to report that according to our studies, we find that AgrAbility works in the 14 states that have provided us pre-test, post-test data. It's funded by USDA NIFA to address mostly physical needs of farmers and ranchers, and it works. Next slide. We've been working about 13 years to collect quality of life data for farmers and ranchers, and we find that overall we improve their quality of life. In our studies here in Colorado and 13 other states, we find that by addressing their physical needs, 82% of AgrAbility participants improved their quality of life levels, and 83% improved their independent living and working levels. That is, they reported they were more able to modify and operate their machinery, complete their chores, and manage their farm ranch. Next slide. But I was interested not only in physical improvements, but also psychological or behavioral health improvements. So my colleague, Dr. Christina Collins, and I wrote and published an article looking at the behavioral health changes. And in 14 states, the group of AgrAbility participants' psychological well-being, even though we only address physical well-being, improved 28%, while the non-AgrAbility group's psychological well-being fell 4%. The AgrAbility group decreased depression, sadness, and worry, and they increased hope. Next slide. In experiential well-being, the AgrAbility group, their experiential well-being levels improved 21%, while the non-AgrAbility group's experiential well-being level fell 2%. The AgrAbility group shifted from life without purpose, now that I'm in a wheelchair, to life with meaning and purpose again. They regained control over their lives. Next slide. In 14 states, the group of AgrAbility participants' support levels improved 20%, while the non-AgrAbility group's support levels fell 5%. They shifted from seeing the world as an impersonal place to one that is caring and responsive. We're real glad to see these psychological behavioral health improvements, evidence-based. It's evidence that we can do something about this. And I want to thank Don McMorran, Kate Seymour, USDA, and NIFA for funding a new behavioral health specialist position. We are going to embed him or her into our Colorado AgrAbility project team. We're in the process of narrowing down the search right now. In year one, she or he will shadow Dr. Jim Craig and Candy Leathers to learn what works to address farmers and ranchers' physical needs and issues, and make good connections with farmers and ranchers so that they're ready to expand and respond to deal with behavioral issues when farmers and ranchers give some sign that they're high stress, anger, depression, or suicidal. In year two, we want to assist you, 5 Western SRAPs, Alaska, California, New Mexico, Utah, and Washington, in referring behavioral health, people who need behavioral health issues and therapy to local therapists. And in year 3, we'll assist 13 Western states and 4 territories. Next slide. Let's build on what we know works to address farmers and ranchers' physical needs. Let's expand to include behavioral health and replace despair with hope. Let's reduce stigma around, especially men recognizing signs of high stress, anger, depression, and suicidal thinking. Let's encourage them to overcome reluctance to continue counseling past initial crisis. And let's partner with behavioral health therapists to help them expand their agricultural competencies. Let's build on what we know works. Let's include behavioral health and replace despair with hope. With your help, we can transform despair into hope. Let's do it together. Thank you very much.
Thank you, Dr. Fitch, for presenting that with us. We're going to move on to our second presenter today with Dr. Aller and Tasha Howard.
Okay, can everybody see that all right? Perfect. Okay, so we're gonna get started. My name is Tasha Howard, and like my introduction said, I am an extension assistant professor here in Utah, and I work in Juab County. So if you're familiar with the geography of Utah, that's kind of, we're right in the middle. We are right along the I-15, and we do have quite a bit of rural mixed with becoming more suburban and urban in our county. So that's who I am. I'll let Dr. Aller introduce himself in just a second, but before we get to that, I just wanted to mention that although we're the 2 presenting, we do have 4 other faculty members and staff who work with us, including a grad student here at Utah State. And so we're just grateful for the opportunity to present on this project, as well as the support that we have from the rest of our team while we're here. And so with that, I'll let Dr. Aller introduce himself.
Yeah, thank you, Tasha. My name is Ty Aller. The introduction provided at the beginning pretty much says it all, but I think the 2 things that I would like to just kind of draw on briefly before we get started is the info that Dr. Fetch kind of provided is a great segue into the programs that we're going to talk to you about today, which is there are a lot of mental health and a lot of stress issues that are occurring along, in rural areas and amongst farmers and ranchers and producers. And our hope is that through creating these 2 programs, the mental health literacy, we can start promoting more prevention in these rural networks to lead towards more referrals and earlier identification of mental health issues, so we can get the actual treatment and get people back to living the lives that they want. Tasha's going to start us off here with sharing us a story of how this might look, and then we'll kind of walk you through to the programs that we're creating and some of the timelines on this.
Okay, so kind of how we got involved in all of this project and the collaboration with the WRASAP grant is last year at the very beginning of 2020, before COVID, before kind of things got a little crazy in the world, we went to teach a class up in Snowville, Utah. This is a small town right on the border of Idaho and Utah, and we were invited to teach the course because there had been a recent suicide in the community. And on top of that, I think it was a Cattlemen's Association meeting, the extension faculty member up in Box Elder County where this town is, they asked him specifically for instruction on mental health. They said, we're seeing it a lot more. We need this instruction. What can we do? So we went up to Snowville, Utah, and we taught this course, and it was a fantastic experience. You can see here we had some of our extension faculty members. They participated in it, and this is a quote directly from one of them. He said, "I didn't think I'd have to use the information as quickly as I did, but I'm glad that I had it." So after we took that class, we got a lot of feedback from the farmers and ranchers who participated in it. And one of the things that they said is it needed to be shorter, needed to be self-paced, and they wanted some more information that was very specific to farming and ranching to rural communities. And so with that, we started working on creating something along those lines. And then this grant opportunity came, the partnership with the Center for Persons with Disability with Dr. Aller and some of the other departments on campus also came together. And so we know that this is an important topic, and even more so, we know that it really does change lives.
Awesome. So what is this class that we're actually talking about? And we call it the Mental Health Awareness and Advocacy curriculum. It's one that I've been working on for about 4 or 5 years on college campuses, and we're working at adapting it. But before we get too much into the program, I just wanted to introduce you all to this concept that actually Dr. Fetsch kind of alluded to quite a bit, which is identifying the stress in our communities and then referring people to resources. Well, this idea is kind of called mental health literacy. It was defined in '97 by Jorm, who's actually out of Australia, as the knowledge and beliefs about mental disorders which aid in their recognition, management, or prevention. But it's not just knowledge for the sake of knowledge. It's knowing these things so you can actually get people access to resources that are useful. There are other trainings like mental health first aid, which is one that's very common going around the nation right now, or the question, persuade, refer trainings. These are all kind of grouped into this mental health literacy grouping. The way I like to talk about it, and I'll often explain it to our students on our campus, is like thinking of a river. Well, as an interventionist or a therapist who works in private practice, which is what I do here in Northern Utah, I serve a lot of people, and it's kind of like going out into this river. I can see them flowing down it, and they're in the rapids, they're experiencing a lot of distress, and I'm over there trying to help them swim to the side. Well, one of the things that I've learned as like a researcher is that, wow, there aren't enough providers to be able to do that for everyone. So we need to kind of shift our orientation to maybe a prevention model. It's kind of like walking up that river to the top of the stream that you can see the picture and seeing that that's actually where everyone's jumping in. So I wonder if we stood here and try to find the people that might be jumping in, if we can keep fewer people from actually being down and flowing down the river. Well, that's the entire idea behind mental health literacy, is to try to prevent issues from occurring or worsening by giving everyone in a population, like all people working in rural areas or gatekeepers, people that are coming into contact with people in rural areas, this information so they know who's most at risk and how to get them access to resources so we can prevent things from getting worse. So that kind of leads into our project. What are we actually working on? Would you mind going to the next slide, please, Tasha? Perfect. So this is the Mental Health Awareness and Advocacy curriculum. Our idea here is to give people basically 3 skills. The first one is how to identify mental health issues. So that's things like, what are signs and symptoms of stress? What are signs and symptoms of maybe things like depression or anxiety? And what might that look like for a farmer? Because it might be different than, a college student that I often work with. So the cool thing about this project is we take what we already know in other populations and we work with our extension faculty to try to make it more specific to rural areas. Then we're also helping people identify what resources in their community are actually useful to treat these issues and to get people help so they can get back to living the life they want. Lastly, we teach them how to respond to people. One of my favorite things as a therapist is actually having these conversations. How do we talk to people about their mental health and well-being? How do we talk to people about stress? And then how do we actually encourage them to use these resources? It's a pretty tough task, but through our course, we think we can help people do it. So who is this for? Well, it's for people that are going to come into contact with people in rural areas. So our first task is training extension faculty and maybe others within the community, like at AgrAbility, who come into contact with providers. And our hope is that by getting to gatekeepers, we're able to help increase our screening. Well, what will you learn? I walked you through that process. You're going to learn how to identify symptoms of distress, identify resources in your community and locate them, and then actually learn how to have these hard conversations in a way that's supportive and encouraging, and in ways that we know actually help people get access to these resources. We're trying to do this in lots of different formats, so it increases the likelihood of people actually using them. So our first one we're doing is through Canvas. We're developing a Canvas course that's self-guided, self-paced, just like Tasha mentioned the request was. This will be available to anyone that can access Canvas on the internet, but we're targeting extension agents first to then start spreading it out. On another project we're working on that aligns with this, we're also doing 1 hour and 3 hour community presentations that will complement these. So if you're out in your community is doing a 1 hour presentation, we actually have some of these that we know can improve accessing resources in 1 hour. Pretty cool. But that's not quite enough because people are experiencing distress. So we're trying to figure out how do we also get to those people where they're at in their communities. And that leads into our next project, which is SelfHelp Strategies. So as Esmeralda kind of mentioned at the beginning, I'm really interested in therapy called acceptance and commitment therapy. And the cool thing about this therapy is that we know you can provide it in really short dosages, meaning like hour trainings or 1 day seminars, and people literally have their lives improve. Their distress goes down and their happiness goes up. So we're taking that therapy and we're trying to find ways to get it to our communities in our rural areas. Well, some of the ways we're going to do that are through facilitated activities during trainings. Tasha, can you actually speak a little bit to what that might look like at like a pesticide training or something to that effect?
Yeah, recently we've been taking, just because there is a huge need and an ask here in Utah, so we've been taking some short, just basic information about mental health awareness, but also about stress and just how to maintain and manage stress. And we've been taking some of these principles that are taught in acceptance and commitment therapy, because obviously the people teaching this have been extension agents. We're not therapists, that's not what we do. It's not what we're trained in, but we can teach life skills. And so we're teaching these stress management skills in an online format due to COVID, but at these trainings where it's an hour long, people come and participate, and they could do some reflective activities and understand a little bit more. Okay, this is how I can manage some stress that happens because of my career field. And so, like Ty mentioned, we've been doing those with the pesticide training, and they're actually getting some safety credits with that. But with the farm and ranching, this is how I can do it with the stresses that I face as a farmer or a rancher.
Yeah, thanks, Tasha. And that hopefully will start getting people's feet wet and they'll go, oh, I really like this. This was super useful. So what we're also trying to do is build out another Canvas course that walks people through, self-guided at their own pace on the internet, ways to apply these skills in their contexts, in rural areas with the resources that they have. And we know that these online self-guided interventions can improve outcomes in as little as 3 hours of work. So the hope is by creating this resource, people will be able to access it. Another innovative idea that we've had and that we know in the research evidence can help support both access to resources and improvement in overall well-being is sharing lived experience and showing how you can use these skills in your everyday life through things like maybe a podcast. And Tasha will tell us a little bit more about how we're doing that.
Thanks, Ty. Yeah, the last thing that we're trying to do is take some lived experiences and put them into a podcast format that can be paired with those skills that we're teaching in the other courses so that we can highlight how this is used in real life. And where this idea came from is I have this arrow pointing to this picture of, and I can't remember if he was the exact person who said it in this course, but we were sitting there and you can see the two instructors are the two of us who are standing up. I'm actually from Las Vegas, so I don't have tons of rural experience other than working in a county now that is rural. I don't have farming and ranching experience. And so we got up there and started talking about mental health, and you could just see these people in this class, they sat back, they folded their arms, and they kind of grumbled about having to be there until the experience was shared. And we were sitting in the course, and we got to the point where you talk about suicide and how to have that conversation. And we talked about the importance of never taking a joke about suicide lightly. And the story was shared, and somebody raised their hand and they said, you know, I can just say that this is true. I was sitting out in a field on a tractor with somebody just a couple of months ago, and he said, I just don't know if I can do it anymore. I think it'd be better off if I wasn't here. And then he said, and that guy's gone now. And that completely changed the entire attitude and environment of the course that we were teaching. Before, it was just some people with some expertise in mental health coming in and talking at these farmers and ranchers. But when that shared experience was talked about, it became something that was real, something that was impactful, and it opened up the room to share more experiences, to understand this is something that is affecting farmers and ranchers. My neighbors are struggling, I'm struggling. And it allowed for that vulnerability and breakdown of stigma that we don't usually see in these courses. And so the goal with the podcast is to really share these stories, to collect them from first in Utah and then around the Western United States, so that we can have those experiences where somebody can be listening out on their tractor and they can hear a story and relate to it, and then utilize the skills that are taught in this class to really bring it to life within their own family, within their own neighborhood, within their own community. And then Ty, I don't know if you had anything else to add to that.
I think that kind of wraps it up, but I would just re-illustrate that, you know, the information Dr. Fetsch provided is really spot on. And our hope is that, like, working conjointly, we can use the context to help drive people to how do we actually access these resources. So I think Tasha actually has our information here on our timelines, my bad.
Yeah, let's talk about when this is going to happen, because it sounds like what we're doing is quite the large overtaking, and we have also felt that. And that's why we're glad that we have within Utah State a team of multiple faculty and staff across the university who are helping with that. So what we're currently working on is going through the content adaptation for what already exists in both an ACT course and a mental health awareness and advocacy course. And we're adapting that content so that it is rural specific, so that the language matches what people who work in farming and ranching would understand, and that it's less scientific based and more just common layman language. Our goal is to have the courses ready by fall of 2021, and then to pilot those courses to Utahns, get their feedback, adjust and adapt, and then in spring 2022 to send that content out to the Western region. Continuing on in the year of 2022, we hope to be collecting data, updating as needed, making sure that we have the best course available, and then also looking for more results from those results to find more funding and make sure that we can continue to have this opportunity available. So with that, I think that's the last bit of information we had to share. Not sure if Ty has anything else to add to that. Here's our contact information if you have any questions for us.
Thank you, Tasha. I was trying to jump the ball. I was ready to just end. Yeah, feel free to email me though if y'all have any questions. Tasha too. I see there's some chatter in the chat going, we're excited. We're excited to get it out too. A little overwhelmed at times, but also very excited.
Thank you, Dr. Aller. Thank you, Tasha, for presenting on this exciting project. There is some great expectation in the chat. People want to see this already, so we look forward to hearing more updates from you guys later on. At this moment, it doesn't look like we have any questions on the chat. I am going to drop right now in the chat a document to access the baseline survey for farmers. Again, like Dr. Groki mentioned earlier, if you guys could help us distribute the survey to the different farmer groups that you work with, or if you're working directly with farmers, it would be really great for us at WRASAP to get information and to get as many farmers to fill out those surveys so that WRASAP programming can be really informed with the information that is collected on that survey. In that survey, I have seen some people filling it in, and I've also seen that people really want, some of the farmers that have filled it in have also said that, you know, they want to participate in the second phase of that survey, which is going to be an interview, because we understand that surveys do not necessarily collect all of the information and all of the experiences and all of the angles of the experiences of these farmers. So please get that survey out to farmers again, so that we can get as much information as possible. And thank you, Dr. Fetsch, for a great presentation, and to Tasha and Dr. Aller. I'm seeing some more comments here on the chat. It says, do you only want farmer info from those living in the Western region? So yeah, the surveys are for the region of the West. If you click on the document that I just linked on a Google Drive, which everybody should be able to access, the link is open. It is labeled on there which states, which farmers can take the survey from which states. So it is for the Western region. And Dr. Groki is saying if there are questions about the survey or goals, please let her know. So Michelle, can you put your email on the chat? I know we have it also on the document that I posted, but it might be good for you to have it on there. And yes, the surveys are currently for agricultural producers, and for they will create a separate survey for farm ranch workers, and that's going to happen for the second year of the WRASAP project. Let's see, I'm just quickly checking the chat here for any more questions. Chats on the Zooms tend to be kind of active. Vicky from NIFA says, I was wondering how are farmers ranchers hear about your program in media? So one of the goals of the WRASAP network is to get a lot of these organizations to work together. And a lot of us have direct contact with farmers and farm workers. That's why we are the vehicle to get that information out there. I know some organizations are also putting some information on like newspapers, and some of us are also doing some public service announcements through our universities. That's how some of the information is getting out. Okay, let's see. I don't know if anybody else wants to share how you guys are connecting with farmers. That's kind of been my experience, but a lot of the people that are involved in the WRASAP network do have direct contact with the farmers. Any other questions? Any words you'd like to say to close, Dr. Fetsch?
I guess just I guess the closing thing I would say is, I think it's imperative that all of us know the signs to look for among not only farmers and ranchers, but everybody who is stressed, angry, depressed, or suicidal, and know how to make an effective referral. By doing that, we can save lives.
So last thing I want to share, thank you, that's really, really important. Last thing I want to share is that our next quarterly meeting is on Thursday, July 8th, 2021. And we will have Maddie from Farm Aid speaking to us about Farm Aid. You can visit farmstress.us. This is the webpage that was specifically designed for the Western Regional Agricultural Stress Assistance Program. So in that webpage, you will find the clearinghouse to be able to find resources in accordance to the state or different topics. You will also find the small grants application applications. The next deadline for the small grant applications is June 30th. You will also find on their contact information for the partners that are working in WRASAP. And you'll find several other resources. Right now, the webpage is still being built out, but as time goes by, you'll see that there's more resources on there. So again, the webpage is www.farmstress.us, or you can also get there by just punching in farmstress.us. So again, once we have a registration link for the next meeting, it should go out sometime in May. But for now, if you could just save the date, Thursday, July 8th, 2021. And with that, I just want to thank everybody for being here with us, with taking the time to be here. A very big thank you to all of the partners in WRASAP, to everybody in our team at California AgrAbility, and of course, our sponsors, USDA and NIFA. At this moment, because we do have a little bit of time, I wanted to open up the floor to see if anybody had anything to comment. Like I said, this is a space for collaborators to speak, and if it doesn't just have to be about presentations, it can also be about what comments do we have to say for the network? And then we have Dana, she's from Monterey County. She has she's announcing an upcoming webinar on mental health and agricultural workers, and she has put the link on there. There's also a fact sheet that she's putting on there on agricultural workers and mental health. And Michelle, Dr. Michelle Groke is going to stay on for a little bit if there are any questions on the survey. If there are no more comments, you guys know that I love to leave a few minutes so that we can all practice what we're trying to do, which is take care of ourselves. I'm not going to disconnect the Zoom right immediately, just in case anybody has questions for Dr. Groke on the baseline survey. But if not, you can feel free to log off the Zoom, get up from your chair and just stretch or take some deep breaths. That's really important for us to do in the work that we're taking on, because it is very important that we take care of ourselves so that we can be able to provide the best services that we can to the farmers and the farm workers that we are servicing. I'm going to stop the recording.
Thanks for hosting, Esme.
Thank you.